for this Footprints conversation today. The Footprint is basically a platform that we are interviewing, inspiring individuals, professionals in the pharmaceutical industry and in the pharmacy profession altogether across the continent of Africa. And the main mission behind the work that we do is to ensure that your journey, your career trajectory, and all the experience that you've had can be consolidated in a way that it inspires the next generation of professionals, but also shapes the trajectory on where we are taking the profession in serving the people that we are working within the continent. So it's a pleasure to host you today, and I'm glad to just give you a moment to introduce yourself so that our audience as well can get to know who Kennedy is.
Thank you, David. When I was invited, I was thinking how old I am, because usually people want to hear stories of older people. So I hope I'm not too old yet, but I think it's a good initiative, especially also trying to hear from younger people. I hope I'm still young. So my name is Kennedy Odokonyero. I'm a pharmacist in Uganda. I've been practicing, I think, for the last, 5 years. Yeah. I think that's a simple introduction. Yeah. Thank you.
Thank you so much, Kennedy. And well, the bit that you've mentioned is the sense that we normally look for mentorship and guidance from very senior people. The difference is you also need to get the guidance and insight from somebody who is almost at your age, who have gone through the trajectory, the way the challenges you're going through are the same thing they're facing and all that. It makes it more relatable and more impactful. So we're honored to have you in this conversation. And I'm glad that at least we've engaged for the last more than 7 years now, and it's been valuable in terms of our relationship. So maybe my first question to you would be, what over the 5 years that you've been in practice, how has the experience been and which particular sectors have you been working in?
That's a good question. I think I think the experience has been good so far, and my areas of practice. Pretty much, I think from internship, I think I knew what I wanted to do. So my areas of practice started from, of course, there's a mandatory hospital practice, but during the hospital practice, we also had exposure in other aspects, in other disciplines of pharmacy, like industry and wholesale or distributorship. And so I think where I found my passion was when I was posted as an intern to work for Joint Medical Studies, one of the biggest distributors of medicines in Uganda. So I loved doing QA work. And so that's why after, finishing my internship, I was recommended by my supervisor then at JMS to join another, importing and distributing company, where I started doing QMS and QA work. I think I did it for about 1.5 years. Then later, I found a bit of interest in pharmacovigilance as well. So it has mainly been, what we call good distribution practice for pharmaceuticals, quality management systems, and then mostly right now I'm more in the space of pharmacovigilance. Yeah.
Okay. So currently, where do you practice, and what is the scope of your work? If somebody was to ask you what you do on a day-to-day basis, what does that look like?
Because most of the work I do is in consulting, so that means I have a number of clients that are always reaching out for for I would say mostly advisory sort of role. So my day-to-day, because I think a number of clients, and I have contractual obligation with those clients, mostly in regulatory intelligence for pharmacovigilance. So most times the clients are reaching out to us or to seek clarification of the different pharmacovigilance regulatory requirements in the continent. But I also have a client that I'm supporting as a local qualified person for pharmacovigilance. So as the LKPV, basically supporting, the marketing authorization holder to comply with local regulations in different parts of the continent. So the day-to-day activity, a lot of it involve, again, it involve giving clarification how the industry can comply with local regulations. Of course, in PV specifically, there's a lot of communication between the health authorities and also the marketing authorization holders. But also submission of cases in terms of individual case safety reports, but also reviewing. We have a lot of reports that we work on a monthly basis, or just setting up systems, because I think the PV that is just, I think it has been like 3-4 months, so we're just trying to set up the local PV system. So we find we're still doing like some bit of trainings, setting the pharmacovigilance system master files. So the day-to-day, I wouldn't say it's typical that I have like pre-planned stuff to do, but usually depends on, the inquiries that I'm getting, maybe from the different clients that I work with. Yeah. So it's a flexible role, I would say, not very, very rigid and stuff like that. Yeah.
Fantastic. Thank you so much for that. And maybe my follow-up question will be based on the same, in the sense that, one, you are in the consultancy space where you are consulting for different clients and all that. And I know most of us as young professionals, when we get out of school, the focus is on getting unemployment and being actually committed to a single role. So what influenced your decision to get into consultancy and actually work with multiple clients? And also the transition for you from mainstream employment?
Good question. I think the realization that you have a specific skill set that you can, provide to many clients. But I think most importantly, maybe my mentor then was also so much involved in consulting. And so that's what I picked from him. And then later, I think I would say my first work as a consultant was a recommendation from someone I worked with in IPSF. I think both of us in IPSF. And so then it started from then that I realized, you have skill set and the pharmacovigilance space in the continent, I think up to now is still pretty much virgin. And so then a lot of the clients don't have, a big human resource pool from the continent to serve them. So then, I realized that, what I can offer, I can give to many clients. But also, I think, of course, the discussion consulting or mainstream employment, that merits and demerits. But I think for me, it's mostly the flexibility that comes with it. And in the sense that you're not tight, with one client. And so for me, the flexibility, to be able to, and also to work remotely, because I think a lot of our mainstream work is, you're working maybe for local organizations. But I would say it's almost 100% the clients that I work with, it's purely remote work. So of course now, when the pandemic happened, remote work, became more popular. Remote flexibility, and also because if you're serving multiple clients, you face different challenges. So then it's an interesting role. It doesn't get boring. Yeah, I don't know if I've answered the question.
Yes, you have, and that's interesting as well. And so one of the key notions that we normally have is that consultants have a lot of money. Do you have that much money?
That's very relative. So the thing is, consulting could be considered more financially rewarding than mainstream employment. But as a consultant, you're not an employee of your client, so it doesn't come with the benefits. For example, maybe pension or health insurance or job security as well. That's lacking in consulting, and so consulting usually like project based. So project usually within a stipulated period of time. And so if the project gets done, then maybe you could have some periods in between that maybe you don't have any projects. So I think both sides really comes in that. If you're looking for security, a safety net where you're sure a monthly pay, consulting may not be so much for you. But if you're looking for flexibility, and you're looking to serve multiple clients, and you're looking for your new exciting challenges every day, you could explore consulting. But also, I think a lot of the audience of this this conversation are young people. I think the misconception usually is consultants should like so old,
yes,
maybe 20 years of experience. But I think you can start somewhere. Really, you can start somewhere, and if you put yourself out there, you'll get clients that that would be interested in your services. So let's not think, or let's not hope that we can start consulting after 30 or 20 years. I think even within 2-3 years, you can take on the challenge, and you learn from it, and then that's how you grow. You shouldn't wait for 20 years. Thank you.
Thank you. The problem of dealing with brilliant people is that they actually preempt your questions. My next question was around the age factor, because most people consider that you have to be experienced and all that to be able to get into the consultant space. But I believe you've already answered that. But now the next follow-up question that will be keen around on that is the age factor and the experience. How do you get the jobs in that space? Being a young person, probably you're not as much in terms of the networks with people who are facilitating these jobs or even working for the companies. So getting the jobs, how do you get that?
I think I write a marketing newsletter on LinkedIn. I think I tried to answer this question, I think at the beginning of this year, in trying to share my own experience of being more exposed. So I think the issue is you have a certain skill set, and let's say you work in mainstream, employment. How do you show to the world, that you have a unique skill set, that you can offer them? And so I think for me, the exposure is important, also the network. I think my first gig was through, someone I network with while I was still a student. So I think the networking is crucial, but also letting the world know out there that you have, for consulting, usually you have a niche. So once you identify the niche, it's important because I don't know everything, and I don't think everyone knows everything in that field. So you identify the niche, then how do you, professionally grow? It's important to, attend trainings. There are lots of even free trainings, not expensive training, just webinars to really know what's happening there. And then there are professional organizations. So if, for example, you're interested in regulatory affairs, there are professional organizations that have regulatory affairs. So, or for me, pharmacovigilance, for example, would be the international side of pharmacovigilance. So, the skill set, the professional organizations, the trainings that you have to be going through, and also, joining professional network like LinkedIn, I think they are crucial. So on LinkedIn, you have to, of course, have a very up-to-date profile, which shows clearly your skill sets and experiences. But also, it's also a big flat platform to virtually connect with people you share similar interests. So I think the exposure comes in mostly, I think for me, has been through using LinkedIn more strategically to show that I have the skills and the experience. So I think in my newsletter in January, I was telling people that if you write about something, it's a good way of marketing yourself, because then it shows that you're an expert, you're a subject expert in that area. So if you can maybe share your thoughts and experiences from maybe the work that you did, even if in mainstream organizations, that helps people. So then you become like so when people think of regulatory affairs, maybe in Kenya or Africa, they think of Peter David. So the exposure professionally, I've mentioned, using professional platforms like LinkedIn, also professional organizations, of course, the trainings, the continuous professional development, and then last was just finding your niche. So I think I also have to mention that, it's maybe, you can still, be in mainstream and then still do consulting as a side gig. But I think for me, consulting is a main gig. So I wouldn't lie to you that, you should leave your mainstream employment and get into consulting, because consulting is not secured, it's not reliable. And so I think you can start with, you have your mainstream, and then maybe you progressively or gradually, then you can move into consulting, so that you're not in a state where, you're not sure of any monthly source of income. Yeah. Thank you.
Thank you so much for that, Kennedy. I think you've shared some critical insights that I'm hoping some of our viewers will be taking note of, but also trying to see how they could position themselves. And I think one key thing that I love about what you've said is being a subject matter expert around the work that you're doing. Because unless you have unique value to offer, I don't think anybody would want to relate with anybody who doesn't have that unique value, that specific skill set that they're looking for. So that is a very important bit. So thank you so much for that. So looking back in terms of your journey into this space, you graduated in 2018, also, if I'm not mistaken. From graduation, did you have it figured out on where you'd be going through? Because one of the questions that I've had recently from some of my young colleagues and peers as well is that I'm getting out of school, but I also don't even know where I want to start.
Good question. I think I think usually I have, passion and interest when we're still in when we're still in school. So for example, you get exposure in industry. I want to be an industrial pharmacist. You go, do clinical work, you want to be a clinical pharmacist. But I think the reality out there is, I think for many people, it's, the first job you learn. So basically the money, your passion follows where the money is, especially after graduation, after internship. So I know colleagues who are very interested in clinical pharmacy, but their first job was, in supply chain, and progressively even their, master's program in supply chain. So I think when you're in school, you should have an open mind. And then maybe, because for me, internship was the eye opener for me to find out really, something that interests me. I mean, the other areas of practice, I found them not as quite interesting to me. So I think having an open mind when you're in school, and also during internship, you can explore maybe where you find maybe your passion and interest. But I think also, again, something I mentioned earlier this year is being strategic. So then you're trying to anticipate, what kind of skill sets or what areas of specialization would be in demand, in a couple of years. Then maybe, trying to build yourself around that, and then progressively maybe, you can grow in that area. So, well, passion, but I think money is important. So you don't want to have passion, and then you be in a space where maybe it's so competitive, you can barely get, opportunities. So I think for graduates, open mindset, then trying to, explore different areas and find something you love, and then also sort of be strategic on where you want to be. Yeah.
Fantastic. Thank you so much for that. And one thing that I love about that is bills must be paid. And one of my friends normally says, passion will never pay your rent. Passion does not feed children and not take care of your family. So you have to find a way to pay the bills, but at the same time, you find something that you really resonate with and you love, and then you grow in that line and you make a decision. So thank you so much for that. And there's one topic that you talked about in passing for a couple of statements in this conversation about IPSF, and even the network that you made around that. And for me, I know what IPSF is. I've been part of the journey as well. What was the value of such profession associations for your student years in shaping your career to where you are?
I think they are really, because I was involved in IPSF, I think for the last 3 years of my studies, but also most importantly, involved in the IPSF leadership. So I think as a student, there are soft skills really that, you gain, by getting involved in IPSF. One is a very diverse and multicultural global organization. So you're in a space where you're working with people from all over the world. So then you learn, how to work in a very diverse community, but also simple skill sets. For example, just writing or emailing, or using maybe tools like Google Drive, Google Docs, or communications. You organize conferences, so you have, you're learning how to, put together events. Of course, you speak at conferences as well, but also, you see, I think I can speak of 2 projects that have got through, people that have, I worked with in IPSF. So you're getting the soft skills, but also you're building your network. So those are the people that, you're basically at the same level of school, you're graduating and moving together. And so the networking becomes important. Of course, you're not going to stay in touch with everyone that you are involved in IPSF or within your local association. But you see, as you professionally develop, all of you, let's say that cohort, you'll identify people that you share, the same interests. For example, me in QMS or PV. Now, a lot of the people that, I interact with them in IPSF that I'm in touch at the moment are people who are involved, in the same areas of specialization as me as well. So it's important, to get involved in those organizations and be active and explore opportunities. I think it's I would say it's very, very important.
Thank you. Thank you. And to the people who don't know what IPSF is, that is the International Pharmaceutical Students Federation. And globally across the world, they have membership from National Association. For Kenya, there's the Kenya Pharmacy Students Association of Kenya, KEFSA. And even KEPSA has its local chapters within universities. In Uganda, I know the Uganda Pharmacy Students Association, which also has university associations and all that. So by being part of that, there's value that we derive. And I'm glad that actually I started my journey from that level. That is where I got to interact with IPSF, and that is where we started our friendship, actually.
I just wanted also to point it out. I don't know where we met. I don't know. I don't remember. But
it was 2017. TDC, Trainers Development Camp in Nairobi.
In Nairobi.
Yes. And I was the KEPSA president by that time.
I thought it was Mombasa or something.
I didn't manage to attend the Mombasa one. So by missing out on the Mombasa one, I got active in KEPSA, and luckily enough, we bid for the TDC and we had it in Nairobi. So been a good journey
so
from 2017.
The rest is history now. Okay.
So thank you so much for that. And the other question that I'll be keen on is, for you making the choice to pursue pharmacy, was it a choice, your first choice career that you wanted to get into? Because also one of the key bits that I've noted with some of the people is that some of them wanted to pursue medicine, then they ended up doing pharmacy. Some of them did pharmacy without clear direction on where they wanted to go, but it was one of the good options that they were advised on, rather.
For me, it was just pharmacy. Pharmacy was the first choice, and I think that was it. I think one, of course, on the lighter side, I think I wouldn't say I knew anyone as a pharmacist when I was in, let's say, secondary school. So I was not having, a role model somewhere. But I think it was because it was very competitive, and so the numbers are limited. I think in our class were around 30, because the numbers have grown over the years. So because it was, and also, again, being strategic, I think pharmacists are still not as many, let's say, as medical doctors. So in a space where it's there are still a lot of untapped opportunities. So I think it was pharmacy from the word go, and also trying to be strategic in looking at maybe this is a field that's not yet overcrowded, and there are still opportunities out there. I think that was how the whole pharmacy thing came about. Although people probably look at me and not consider myself as a traditional pharmacist. Because traditionally pharmacies are you have to be in a community pharmacy. Or be in a hospital, or so for me it's, well, I know many colleagues who are sort of diverse, and I think that's the beauty with pharmacy as well. I know people who have gone into finance. Can you imagine? They are going into finance, and some people went to law school. So it's a very diverse, you can still explore other opportunities as well, even after your pharmacy, your first degree in pharmacy.
Thank you so much for that. And there are people who will always still be considering you a pharmacist, and they call you once in a while and asking you for medication. How do you deal with such people?
So I think one thing that I think this is personal for me, I love working behind the scene. So I think of facing clients or facing patients or working directly. For me, it's not where my passion lies, and so I prefer to work behind the scene. And so, of course, you still, if you go to your village, your grandmother or your auntie will always say, I've had this pain on my back for the last 5 years. So then, of course, I've not lost or completely, move away from, providing, pharmaceutical care or services or advising people. So I still do that in terms of trying to guide if someone asks for advice, but also pointing them to where to go, or what consideration they have to make in trying to manage whatever ailment they have. So those questions still come, but I also have lots of friends that work in community pharmacy. I think a lot of the questions you get as a pharmacist, where can I get this product? Someone is looking for this product, where can I get it? So I have friends who are really passionate about community pharmacy, who runs community pharmacies in Uganda. So I know where to call to ask, hey, do you have this product? How much is it? Where can you get it? Or all those questions.
Fantastic. That's amazing. Because actually, one of my friends recently told me that being a professional is not knowing everything, is knowing where you can get what you need. So then you can refer them to the people who give them the answers. That is a very commendable bit.
True.
So thank you so much for that. And I think my next question would be for you as Kennedy, the consulting work, the professional line of pharmacist, whatever line of work that you're practicing. It's challenging. It has its own dynamics and all that. How do you get to decompress and get spare time for yourself?
Well, consulting, as I mentioned, it's flexible. So it's flexible, really. I think it's flexible, and there are seasons, of course. For example, it's a certain client, maybe every quarter, maybe you have a week which is a bit intense. But other than that, maybe you have so it's flexible. So I wouldn't say, of course, I mostly work from home. So I think the time is there, to go for a hike or go for a run or to, even sleep a little, because I think there's a project I work with, people from Latin America, Europe. So the time zone is so big that if I'm waking up, my friends in Colombia or Argentina are sleeping. And then as I'm going in the evening, that's where the email starts coming in. And of course, for them, they're just starting that day. So of course you can, what's I saying, you should be able to chew what you can swallow. So I think we shouldn't be what's the word, greedy in terms of, if I get project but I know I'm occupied, I shouldn't accept to take on those projects when I know I cannot deliver. So then I will look within my networks and who can do this work for this client. And then so I mean I'm still conscious that you still have to keep your head clear. It shouldn't be all the time you're working, and so the time is there because it's a flexible role in terms of working remotely, and also there are times where it's not so intense. Then you can get time to do other things. Yeah.
And you've mentioned that aspect on how you decompress and all that, and I know you are a runner. What inspired your interest into running? Because I know the Ugandans are not so good runners.
I think Ugandans are good runners. At least in the long distance running,
you're not that much.
Can you see my medals though? Those are lots of medals behind there. In fact, I even went.
Are they honorary medals or are medals that you won a race?
No, I've actually won races, maybe, especially in my age group. I wouldn't go so much into that, but I think. I think, of course, the pandemic happened and, people found, passion in different things. And so for me, I used to run when I was doing my internship up country, but, when you come to the city, it's a very busy, the roads are crowded. And so you always fear for your safety. And so I used to run during internship because internship at the hospital was so intense. So like me and my friend wake up, do a 5-kilometer, come back to the hospital because we're staying at the hospital, shower. Then you realize, after running in the morning, you tend to have a more active and productive day. You wouldn't feel so tired or, so, but, Kampala, the roads are narrow. You don't have, pedestrians walkway that much to run. But of course, the pandemic happened, lockdown, roads are empty. Yeah. That's how it all started. But I think it was, for many people, some people took hobbies during COVID, but once the lockdown was lifted, I think the hobbies also, lifted and lifted themselves. And so I think mostly, through the lockdown, and I think the journey of running is, it's a very, a motivational speaker can tell you one day, you have to persevere, keep doing what you love, but maybe seeing, the tangible gains becomes hard. But with sports, you can easily you can see your progress is so measurable that if you're able to do 5 kilometers within 15 minutes, and then in 3 months you're able to do within 40 minutes, so then it's very measurable in terms of the gains or the progress you're making, and it's a very the challenge that you put yourself, and also trying to always imagine there's always the unknown. Can I do it within the next 20 minutes or 17? Yeah, and keeps your mind a bit sane.
That's fantastic.
And all that. Yeah.
When you're talking about the people who picked up hobbies during COVID and abandoned them when the restrictions were lifted, I was wondering, why are you just not being direct and telling me, David, you used to mention you used to run at one point?
Yeah.
I'm one of those people
Yeah.
who lifted the restriction with my runnings aspects as well, but I'm hoping to go back
Sure.
into it. So it's well. So I'm looking at it in the sense that what are some of the key enablers to your journey to where you are now that you could point and say, these are things that have helped me become the person that I am today?
I don't know if I know where I am, but but I think I think being active in student leadership, I think that influences a lot. So I would say student leadership, being active in associations, and of course, maybe the mentorship and the opportunities I got through internship, and also of course, you see, even with PV, how I first fell in love with PV, I think was through a colleague that I was involved in MOPSA, who now work for the Health Authority in Uganda. So there was a stakeholders meeting in Pharmacovigilance. And so he just invited me. Yet I think then I was over 1 year into practice. So once he invited me for that meeting, that's why I started thinking, oh, these guidelines are being developed, so there will be requirements in a few years, and then the industry will start looking for people, to help them comply. So I think even PV or QMS, I think the student leadership, I think, was a key enabler, because usually it's you always look around the people you really serve with in the associations if opportunity comes in. And so I think that for me has been a key enabler. And then of course progressively, the exposure, how we have to, market ourselves, build a certain brand and, find a niche. So I think the exposure has also been important in terms of being an enabler. And I don't know what else. Yeah, the networks, of course, professional organizations, of course, for pharmacists, maybe progressively you get into FIP, International Pharmaceutical Federation. I don't know if you'll help me summarize afterwards what I've said. I think the student leadership, I think for me, if I'm to rate, I rank them as the first, the networking, the professional organizations, and of course, the relentless continuous professional development. I think in a month, recently I was submitting my CV to a certain health authority. And then, I had so many certificates, because at some point for certain opportunities, you'll be required to show, what kind of trainings or continuous professional development activities you've been doing. So I think the CPDs helps a lot, not just to, for example, in tenure to make sure you renew your practicing license, but actually know what you're learning from it. And maybe much later, some client will ask, that, have you been, being, up to date with, so the CPD helps. The CPD helps. I think those would be the enablers. I wouldn't say that's, the magic that should work for everyone, but maybe you can find something that's relatable to you and maybe try to be more intentional towards developing yourself. Yeah.
That's fantastic. And in terms of some of the things that you've said, as much as you think there are so many, the aspect on professional leadership, student association, that was a critical bit, because then you form the right networks with the right people with shared interests, and also people who are pushing themselves, because not everybody will get into leadership. So that is a key bit. Then you looked at the aspect on the networks and the relationship that you formed. Then subsequently, then the commitment and the intentionality in terms of what you're pursuing. Because also one thing that I've noted among most of our young colleagues and peers as well is the sense that you have so much possibility. It's like you are an omnipotent cell. You have so many possibilities, but you're not pursuing any of them. And therefore, then you'll never realize your potential, which becomes a loss for you and a loss to the system where you're part of. So that's a good commendable attribute. And I'm glad that your journey is moving. And where you are, it's amazing, because I look up to you and I see the kind of work you're doing. And I'm hoping maybe one day I'll get to that level as well.
Oh, okay.
Yes.
Thank you.
And to be able to have flexible time, and good money. So that's for sure. Then I begin to look at it in the sense that for Kennedy, what does success mean to you? And do you consider yourself successful where you are?
I really should ask me these questions after, maybe when I'm more bolder than this. What does success looks like? That's a good question. If you really don't have an answer, I don't know, at a personal, professional level, I don't know, maybe people would disagree on maybe how ambitious I am as a person, but I think I think it's I think that's what I was trying to say earlier. I think a couple of weeks ago during the APN webinar on pharmacovigilance, I think we'll not be in the dance floor all through. So I think success would probably mean mentoring someone, training someone, to take over. Yeah, and I think for student leadership, I think I love it when I see maybe my student, association is still very active and vibrant now, so it's so the sustainability and the continuity of the things that we do. So it shouldn't like die out with us, when we leave. So I think for me that, how success would look like if, there's someone else, who will probably do the same stuff, but, much better than me. And yeah, so the sustainability becomes important. And I think, I don't know if that is philosophical enough or motivating enough. Yeah,
it is
but
valuable.
maybe it would change after, a few years again or 10 years again when we talk again. Yeah, but I think for me, that's what success would probably look like.
Seeing the impact of what you did, carrying on, and
Yeah,
somebody
yeah.
doing it better and making it sustainable. Fantastic.
Yeah,
That's
yeah,
commendable as well.
yeah, yeah.
And I think in a way, I'm just thinking of it in the sense that most of the things that we do die off with us because we never mentor the next generation of people to take over from us and actually do the work. Then ultimately, then it means there's one phase of people who did so well. Then the subsequent generation has nowhere and has nothing to do because they were never guided in terms of what needed to happen, or they'd have to restart a process afresh from zero, which is a risk to the sustainability and the growth of the organization that we are working with, and even to the human race in terms of the generality of how things would be. So that would be a good bit for us. So in terms of your career, what has been the proudest moment in terms of your practice?
I think I think usually because I consider myself as a mid-level person or behind the scene. So I think there's a project we did in Kenya last year, and I think here I was presenting on, to very senior people, at the US Embassy in Nairobi. And I was like, okay, I first took a step back and like, oh wow. So I think I look at that moment as, being able to present our findings from what the work we're doing to very senior, very influential, people that, control budgets, for example, or influence policies. I think for me, that would stand out, being able to, at such a high level meeting and present the work that you have done and to people that, controls huge budgets that has, big impact, on the population or the citizen of that country. So I think, yeah, I think that was really quite a moment to look back. Yeah.
Fantastic. Thank you so much. So if somebody was out there watching this video and asking themselves, what do I need to do to be Kennedy or to be so as Kennedy is in his life? What would be your advice to that person?
Oh, that's a good question. I'm not sure if I want people to be like me, but I think people to be able to, navigate their own path and find out what really works for them. So I'm not so much a proponent of try to strictly follow someone's path. I think you can always create your own path and work towards, you asked me what success means to me, but I think success means different things to people. So then based on maybe what success looks like or where you want to be in the next couple of years, that's able to help you navigate that path. Maybe, maybe there are learnings, from me that someone can take, but not exactly, being me or, being, do exactly what I've done. But maybe there are certain, common things or shared, values that someone can take. So I think maybe we'll still go back to, those key enablers. It may not work for everyone, but I think especially for the young folks, being active in leadership or or trying to network, or continuously try to grow yourself, to learn and learn and learn. The learning never stops. I think those could be the things someone can do to to progress in their career, or wherever thing that they love doing. Yeah.
Fantastic. Thank you so much, Kennedy. It's been a pleasure having this conversation with you. And I've really learned a lot in some of the things that you're doing as well, even though we've known each other for the last 7 years. And I'm looking forward to us building this journey and seeing what we can do, what impact we can make as we move along. So as we come to the end of it, any last remarks or any last comments? Over to you.
I think a vote of thanks to APN, especially the administrative assistant, Juliet, for putting this together, and also you for the invitation. And so I think for all the listeners, or the viewers, I hope the story, or the conversation with David here, maybe just one thing or two you can take from it to help you develop, or grow in wherever space that you're in. Yeah, thank you.
Thank you so much, Kennedy. It's been a pleasure, and I look forward to more engagements as we move along in this journey. Really appreciate it.
All right.